What inspired you to become a rehabilitation nurse?
My journey toward rehabilitation nursing stemmed from a deep fascination with the human capacity for resilience. During my clinical rotations, I witnessed firsthand the transformative power of rehabilitation care. I was particularly moved by a patient recovering from a severe stroke. Initially, he struggled with basic movements and communication, but through dedicated therapy and the unwavering support of the rehabilitation team, he gradually regained his independence. That experience ignited a passion within me. I realized I wanted to be a part of that process, helping individuals reclaim their lives and achieve their full potential, even in the face of significant challenges. The idea of empowering patients to overcome obstacles, regain lost skills, and improve their quality of life became my driving force. It's not just about treating the physical ailment, it's about fostering hope, celebrating small victories, and supporting patients and their families through a challenging and often emotional journey. That's what draws me to rehabilitation nursing, the opportunity to make a tangible difference in people's lives and witness their incredible strength and determination.
Describe your experience with different types of rehabilitation patients, e.g., post-stroke, orthopedic, neurological.
Throughout my nursing career, I have had the opportunity to care for a diverse range of rehabilitation patients, each requiring specialized care and support. I have worked with post-surgical patients recovering from orthopedic procedures such as joint replacements and spinal surgeries, ensuring pain management, mobility assistance, and wound care. Additionally, I have provided rehabilitative care for stroke patients, focusing on regaining motor functions, speech therapy coordination, and emotional support to help them regain independence. My experience also includes working with patients recovering from neurological conditions such as traumatic brain injuries and multiple sclerosis. In these cases, I have collaborated with physical therapists and occupational therapists to develop individualized rehabilitation plans, helping patients rebuild strength and improve daily functioning. I have also cared for individuals recovering from cardiac events, ensuring they follow rehabilitation protocols, manage medications, and adopt healthier lifestyles. Beyond physical rehabilitation, I have supported patients with psychological and emotional recovery, particularly those overcoming substance abuse or long-term hospitalizations. I prioritize a compassionate and patient-centered approach, ensuring each individual receives holistic care tailored to their unique recovery needs. My goal is to empower patients to regain their independence and improve their quality of life through dedicated, evidence-based nursing care.
How do you approach developing a care plan for a patient with complex needs?
Developing a care plan for a patient with complex needs requires a holistic, patient-centered approach that integrates medical, psychological, and social factors. I begin with a comprehensive assessment, gathering information about the patient's medical history, current condition, functional abilities, and personal goals. This involves collaborating with the healthcare team, including physicians, therapists, social workers, and the patient's family, to ensure a multidisciplinary approach. Once I have a clear understanding of the patient's needs, I prioritize interventions based on the most urgent concerns while ensuring long-term goals are also addressed. For example, if a patient has multiple chronic conditions alongside mobility limitations, I ensure their medication regimen is optimized, pain management is effective, and rehabilitation therapy is incorporated into their daily routine. I also consider psychological and emotional support, connecting patients with counseling or support groups if needed. Continuous monitoring and reassessment are essential, as complex cases often require adjustments to the care plan. I maintain open communication with the patient and healthcare team, regularly evaluating progress and making necessary modifications. My approach is always evidence-based, compassionate, and adaptable, ensuring that each patient receives personalized, effective care that enhances their quality of life and promotes independence.
How do you motivate patients who are struggling with their rehabilitation progress?
Motivating patients who are struggling with their rehabilitation progress requires a compassionate and individualized approach. I start by understanding the underlying reasons for their frustration, whether it's physical pain, emotional distress, or a lack of confidence in their recovery. Building a trusting relationship is essential, so I listen actively and acknowledge their challenges while reinforcing their strengths and past progress. I set realistic, achievable goals with the patient, breaking down their rehabilitation process into smaller milestones. Celebrating even minor improvements helps boost their confidence and keeps them engaged. If they feel discouraged, I remind them of their initial progress and the long-term benefits of their efforts. Additionally, I incorporate their interests into therapy when possible, such as using music, hobbies, or family involvement to make exercises more engaging and meaningful. Collaboration with the rehabilitation team is also key. I work closely with physical and occupational therapists to adjust care plans to match the patient's comfort level while still encouraging progress. Emotional support is equally important, so I provide encouragement and, if needed, connect them with mental health resources. My goal is to create a positive and supportive environment where patients feel empowered to continue working toward their recovery.
Describe a time you had to advocate for a patient's needs within the rehabilitation team.
In my role as a rehabilitation nurse, I encountered a patient recovering from a severe stroke who was struggling with mobility and communication. Despite the patient's determination, I noticed that their rehabilitation plan did not fully address their speech therapy needs, which were essential for both their emotional well-being and functional recovery. The patient and their family expressed frustration, feeling that their concerns were not being adequately considered. Recognizing the importance of a holistic approach, I advocated for the patient by discussing their needs with the rehabilitation team. I coordinated a meeting with the physical therapist, occupational therapist, and physician to review the patient's progress and challenges. I presented observations about their difficulties with speech and swallowing, emphasizing how improving these areas would enhance their overall quality of life and independence. As a result, the team adjusted the care plan to include more intensive speech therapy sessions and alternative communication strategies. Seeing the patient regain some ability to communicate and express their needs was incredibly rewarding. This experience reinforced my commitment to patient advocacy, ensuring that every individual receives comprehensive, tailored care that supports their full recovery and long-term well-being.
How do you stay updated on the latest advancements and best practices in rehabilitation nursing?
Staying updated on the latest advancements and best practices in rehabilitation nursing is essential for providing high-quality, evidence-based care. I actively engage in continuous learning through professional development opportunities such as attending conferences, workshops, and seminars related to rehabilitation nursing. These events allow me to learn from experts, gain insights into emerging therapies, and stay informed about the latest research and technological advancements in patient care. I also prioritize reading peer-reviewed journals, clinical guidelines, and publications from organizations like the Association of Rehabilitation Nurses, ARN, and the World Health Organization, WHO. These resources help me stay informed about best practices, innovative rehabilitation techniques, and new treatment protocols. Additionally, I participate in online courses and webinars that focus on specialized areas such as neurorehabilitation, pain management, and assistive technology. Collaboration with colleagues and interdisciplinary teams is another key aspect of staying updated. By engaging in case discussions, attending team meetings, and sharing knowledge with therapists, physicians, and other nurses, I continuously refine my skills and adapt to new approaches. My commitment to lifelong learning ensures that I provide the most effective and compassionate care to support my patients' rehabilitation and overall well-being.
How do you handle the emotional challenges of working with patients who are facing long-term recovery processes?
Handling the emotional challenges of working with patients undergoing long-term recovery requires a balance of empathy, resilience, and self-care. I recognize that rehabilitation can be a difficult and sometimes frustrating journey for patients and their families, so I make it a priority to provide emotional support while maintaining professional boundaries. One of the ways I manage these challenges is by building strong, trusting relationships with my patients. I take the time to listen to their concerns, acknowledge their struggles, and celebrate their progress, no matter how small. Encouraging a positive mindset and fostering hope helps patients stay motivated, even during setbacks. At the same time, I remain realistic and honest, helping them set achievable goals while providing reassurance that they are not alone in their recovery. To prevent emotional exhaustion, I practice self-care and seek support from colleagues when needed. Engaging in debriefing sessions, sharing experiences with my team, and maintaining a healthy work-life balance helps me stay emotionally resilient. I also remind myself of the impact I have on my patients' lives, which reinforces my passion for rehabilitation nursing. Ultimately, my ability to provide compassionate, patient-centered care stems from maintaining both my emotional well-being and professional dedication.
Describe a time you had to deal with a difficult or uncooperative patient or family member.
During my time as a rehabilitation nurse, I cared for a patient recovering from a spinal cord injury who was struggling with the limitations of their condition. Understandably frustrated, the patient often refused therapy sessions, declined assistance, and expressed anger toward staff. Their family was equally distressed, frequently questioning the treatment plan and expressing doubts about the rehabilitation process. Recognizing that their resistance stemmed from fear and frustration, I approached the situation with patience and empathy. I took the time to listen to both the patient and their family, acknowledging their concerns and validating their emotions. I explained the rehabilitation process in a clear, reassuring manner, emphasizing the importance of consistency and small milestones. I also worked closely with the interdisciplinary team to adjust the care plan, incorporating activities that aligned with the patient's interests to make therapy sessions more engaging. Over time, the patient became more receptive to care, and their family developed a greater trust in the rehabilitation team. By maintaining open communication, showing empathy, and adapting the approach to their needs, I was able to turn a challenging situation into a more positive and collaborative experience. This reinforced my belief in the importance of patient-centered care and the power of compassionate communication.
How do you prioritize patient safety in the rehabilitation setting?
Prioritizing patient safety in a rehabilitation setting requires a proactive and multidisciplinary approach. I begin by conducting thorough assessments to identify potential risks, such as fall hazards, pressure injuries, or complications from underlying conditions. By understanding each patient's mobility limitations, cognitive status, and medical history, I can implement individualized safety measures that prevent accidents and complications. One of my key strategies is fall prevention. I ensure that patients use appropriate assistive devices, maintain a clutter-free environment, and receive supervision when needed. I also educate patients and their families on safe movement techniques and the importance of adhering to therapy plans. Additionally, I closely monitor vital signs and pain levels to prevent overexertion, dehydration, or adverse reactions to medications. Effective communication within the rehabilitation team is essential for patient safety. I collaborate with physical and occupational therapists, physicians, and caregivers to ensure a coordinated approach to care. Regular reassessments allow me to adjust safety protocols based on the patient's progress and changing needs. Beyond physical safety, I also prioritize emotional well-being, ensuring that patients feel supported and confident in their rehabilitation journey. By combining clinical vigilance with compassionate care, I create a safe and supportive environment that promotes recovery and independence.
What are your salary expectations for this role?
When discussing salary expectations, I consider factors such as my experience, qualifications, the responsibilities of the role, and the standard compensation in this healthcare setting. Based on my background in rehabilitation nursing, my expertise in patient care, and my ability to work within interdisciplinary teams, I am looking for a competitive salary that reflects my skills and contributions. However, I am also open to discussing the full compensation package, including benefits, professional development opportunities, and workplace support. My priority is to find a role where I can make a meaningful impact on patient care while growing professionally. I would be happy to discuss salary further after learning more about the organization's expectations and the overall benefits offered.